talking to him on the phone. His name is Anthony Santella, and he was a friend of mine. Is a friend of mine from high school. He actually graduated in the class just behind me. And he is a PhD in public health. So he's following the coronavirus trend very, very closely. He is going to be featured. He's been featured on a lot of news broadcasts, actually, because this is his area of expertise, not on the coronavirus, predominantly on the HIV virus. Hey, Anthony, but I'll let him introduce himself to you. Essentially what I wanted to do, he's actually going to be featured. Anthony, let me invite you soon. He's going to be featured on a news broadcast tomorrow, offering some expert advice too. So I'm definitely going to want to download this video and upload it to YouTube, because I think it's really important. Finally, an idiot is going to get to ask an expert questions directly, so that we can sort of circumvent the whole, prepared media, and they have their kind of like talking bits beforehand. But now this is just like straight talk directly to him. And I just want to say thank you to Anthony ahead of time for even coming on and doing this with us, because I know that you're very busy. But here, let me invite you on. Hold on. Anthony. Go live. Let's just see if this works. So I'm waiting for him. Can you hear me? Okay. I was really, so everybody that's on, like I said, even if there are only 11, 12 people on, Anthony, I'm going to upload this to YouTube so that more people can hear it, because I want to straight up, I'm so excited to be able to talk to you. Anyway, Anthony, this is Anthony, everybody. Anthony, introduce yourself, because I know that you're a PhD in public health, yes?
Mm-hmm.
Right.
Can you hear me okay?
This is your area of expertise.
Can you hear me okay?
I can, absolutely. Can everybody else hear me okay?
Okay, great. This is my first Instagram live, so I'm so excited. It's a first. Hi. Like Michelle said, my name is Anthony Santella, and Michelle and I went to school many moons ago, and we recently reconnected at a Super Bowl party at my sister's house, so I was glad to reconnect. And like Michelle said, I went to school for public health and got my graduate degrees all in public health, and really have focused largely on HIV, but also other infectious diseases, and how we can prevent them and control them in communities, particularly communities that are otherwise vulnerable or marginalized, like people who don't have a choice where they are, like if they're in a hospital or a homeless shelter or a jail or prison or something like that.
So that's one thing that in particular I love that you focus on, because a lot of times what happens when people are really afraid is that they start to get aggressive and behave in ways that are disrespectful, sometimes prejudiced, sometimes racist. People can be discriminated against for reasons that they don't freaking deserve. And it doesn't even make any sense, because it's not helping the situation either.
Yeah, and unfortunately, with the example with coronavirus, it's as much a social disease as a biological one. You know, there are stories, particularly out of other countries, where there are signs outside of restaurants that say, no Chinese tourists allowed, or Asian people not welcome. And you probably have heard of stories just here in the United States where Chinese businesses, particularly restaurants, have had to close down either temporarily or permanently, because people are blaming them for this, and no one community really is to blame for this.
No, I mean, how could they be? It's a freaking virus. That's what it is. Now, so first of all, plug yourself, because you're about to be featured on a news station tomorrow. You've been featured many times, right, as an expert guest. So what is the news station tomorrow that you're going to be?
If you go on Facebook to Pix 11 News, and just like them or follow them, tomorrow at 11 o'clock, they'll air it on their Facebook page, because it's otherwise the original airtime is super early in the morning, and I'll be asleep as well, which is 6:30 a.m. But I'm going to watch it on Facebook, on their Facebook at 11 a.m. And like I said, it's Pix 11, and they have myself and a physician who's an internist at Mount Sinai, a psychotherapist, and an economist, all talking about the public health, the medical, the psychological, and the economic implications of this pandemic. Well,
Yeah, so
some of your people will be up that early. So if you're up at 6:30, go to Pix 11 and you'll see it.
What is that, Anthony? 6:30 Eastern Standard Time?
Yes.
Okay. I mean, it's not too early. It's not too early, especially if you care about this. So
I like Jackie's comments.
Jackie's awesome. Jackie's awesome. So I'm going to hit you with, like you said, idiot to expert, right? Because I've been a skeptic. I'm going to say it straight out. I've been a skeptic from the very beginning. And I even sent you over some numbers because I didn't understand why people are reacting the way that they're reacting. And let me explain to you why. And every single time I'm watching experts on the news like yourself, but I can't ask my questions. And I'm yelling at the screen, like, why can't you just make this, right? But here I am. And now thanks to you, I get to actually say straightforward what I'm thinking. First of all, I just wish to God everybody always opens up their newsreels with the red world map and the death tolls, right? Everybody. It's like alarmist. And it's shocking and it's scary. And I get that fear sells, but I don't think that that's responsible. I really don't. I've had a big problem with it ever since it started. And I say to myself, I was like, why don't they just straight out let everybody know this is not the bubonic plague. 75% of us are not going to die of this. This does not have the death rate, and tell me if I'm wrong, interrupt me at any time, but this doesn't have the death rate of the original outbreak of Ebola or the original outbreak of HIV before we had all this wonderful medicine that we had. I mean, both of those things were death sentences, flat out. So I could understand, like, thank God that they didn't spread as easily as the coronavirus, right? So they were easier to contain. And like I said, just keep yelling at me if I'm wrong. Yeah. And I'm like, 98% of us are projected to be totally fine. And if we get sick, most of us are not going to die or even get sick that badly. This is something that will affect more people than the flu does. And it could be much worse for those more people, as in, more people will have to be hospitalized, get attention, get ventilators, get additional aggressive medication. But that doesn't mean death tolls. That doesn't mean death and gloom. And from my position as a skeptic, I was always like, well, why don't they just let people know straight out that people are not going to die of this? People are not going to die. Like, most people are going to be fine.
So, it's hard to directly answer that. I will give you an answer, but it is hard to directly answer that because we're in the thick of things right now. Okay. So anyone that says this is better or worse or more contagious, less contagious, higher death rate, lower death rate compared to anything like Ebola, MERS, SARS, seasonal flu, HIV, etc., we really don't know because we're in the middle of it. All those other illnesses, and I will compare them based on what we know right this second. Okay. We've had time to sit back, reflect, crunch all the numbers, and do all that. We won't be able to do that for months to come. So that's one thing. The second thing that's important to say is at the beginning of something, and we pretty much are still in the beginning of this, right? Because it's been about 2 months that we've been kind of active about it here in the United States. You're going to see the sickest people present, get diagnosed, hospitalized, and die. So eventually those numbers will flatten out because this is hopefully doing its course and we'll get past this. But, the death rate right now in the United States, which is about 4%, that will not be the final death rate because we need to let this play out. We need to test more people. We need to give people time to recover. All that stuff is happening. It was all over the news yesterday, including the president's press release or press conference that they're going to increase the capacity for testing. And they have these drive-through testing. I saw a picture of Denver, Colorado. There's already hundreds of cars cars in line to go through this drive-through testing. We need to let all that play out before we really know. Now, what the credible scientists say, the ones that I respect and I follow, particularly from the National Institute of Health and the Centers for Disease Control, anticipate the fatality rate will be something like 1%. So 1% is still much higher than the 0.1 of the seasonal flu, but it's nothing compared to 10% for SARS, 30%, 33%, 34% for MERS, Middle Eastern Respiratory Syndrome, and like 50% for Ebola. Nothing like that. But 1% is still 1%. But who knows what that will be? Just like how contagious it is. Measles and smallpox are super contagious, much, much, much more contagious than the coronavirus or any of the other viruses in that family of viruses. But, last year you saw that we had a measles outbreak, particularly in New York. And so we have a vaccine for measles. So all this has to play out a little bit before we really know where things stand. Now, unfortunately, things have to get bad before they get better. And so what we're seeing right now, like literally yesterday, today, early next week, is things closing, things being canceled, things being delayed, people being encouraged not to gather in large groups and stuff. Because now we have to kind of put it out there to the population, the community, the American public. If we're really going to control this, we have to have people take their own individual responsibility, which is much easier said than done in times of uncertainty. We also have to increase testing capacity, which you saw the federal government make their moves about that yesterday. And we have to let this play out a little bit. And the only way you can really do that is if you kind of slow things down. And we don't like to be inconvenienced, right? That's not our style as Americans. And March and April, we're going to be inconvenienced. And that's just how it's going to be. And I'm very hopeful that by the end of April or early May, everything will be back to normal.
So you don't necessarily think, like I think, this is all exaggeration, like we're overreacting. You think this is actually a good thing that we're doing? Like all of the schools are closed. My son, all colleges are being put on, online courses. This is good.
Well, no one wants to be that one school, that one college, that one after-school program, that one whatever that doesn't do what everyone else is doing, and then something happened. So what happened is kind of a domino effect. Some schools started closing. Now the other schools are like having parents complain, why aren't our schools closing? And in some parts of the country, that's easier said than done. Like in New York City, they're under one school system. So the school chancellor decides everything for the 5 boroughs. Excuse me. And you see how I coughed. Although I'm not sick. I'm just coughing. In a place where, like, I live on Long Island, there are 150 different school districts. They all operate independently. What one does has no impact about the other. So every place around the country operates a little different. So I know it makes people really anxious about, especially when schools close, because, again, that has a domino effect. Where are these kids going to go? What if their parents still have to go to work? Or can they leave their kids alone? Do they have someone to leave them with? Are they then just gathering kids together, which is no different than being in a school? What about kids who rely on free or reduced cost lunch? What about, there's a lot of things that happen when the schools close. But the good news, I don't know, maybe a silver lining, is that, the state governments have responded, in my opinion, in a prompt way. So, a lot of schools, including New York and Connecticut, the governors have relaxed the 180-day school rule. And so that, there will be an end to a school year. Kids won't be held back because of this. And, there are flexibility with canceling, for example, like April breaks, Memorial Day breaks, extending the school year by a week or 2 weeks in June. There's a lot of flexibility with the K-12 school system. There really is not a lot of flexibility with higher education, which is why these colleges, which thankfully right now are spring break season, which gives them some time to figure things out, are much more able and capable of moving online because they have the infrastructure, technology, and systems to do that very quickly. So I don't think there's anything necessarily wrong with that, but I knew as soon as one place did it, everyone else is going to jump on that bandwagon. Because do you really want to be that school that ends up with like 10 cases, someone's hospitalized, someone dies? It's just a PR nightmare. People don't want to do that. I do think people are too connected to this. You can't turn on the TV or social media without being bombarded with coronavirus.
I know.
And, you know, the numbers are going to go higher because we're testing more people. The number of hospitalizations are going to go higher because we're testing more people. We're going to have deaths. That's inevitable, just like we have deaths related to flu. So do we need to be updated with that multiple times a day, every day, through every medium possible? No. Do we need some updates? We sure do. Because then, you know, then people start saying, well, is this a conspiracy? Did the government do this on purpose? What's happening? So, you know, we need some information. We don't need to be bombarded with it. And I do think local, state, and federal government has a responsibility to keep that in control.
Let me say something to that point, Anthony, because I think the CDC has done a good job providing us with legitimate data and information. I think local health departments have done a good job providing us with that data. I think a big problem is the way that that data is being shared with the public overall, in that you can definitely, I'm an astrologer, I'm a tarot card reader, but I can go onto the CDC website, I can use my own brain, and I can read the actual data that's provided by people like you. Well, the problem is that people like reporters, and it's all straight from CBS, NBC, ABC, CNN, Fox, it's all of them. The first thing they bombard you with, the death toll is now up to 2. The death toll is now up to 11. And I'm like, this is not bring out your dead 14th century England. What is wrong with the way that you're talking and sharing this message? I don't understand that. And to me, that's a level of social irresponsibility that I think is very threatening, because fear can go viral as well. Do you know what I'm saying? Like, when people get afraid, they do crazy, stupid things. Like, for example, I was thinking, you know, when we were kids, we still used to get chickenpox because the vaccine wasn't that popular. And everybody under 40 everybody over 40 has a little pockmark on their head, right? What our parents used to do was they used to take us and put us near a kid that had chickenpox and say, here, just get it so you can get it over with, right?
Yeah.
And so my thought was, well, why are we so afraid of this virus that's not going to kill many people? Why don't we just get it and get it over with? But A, that's probably idiocy, and you can speak to that point. And also B, if all of us all of a sudden got sick, there would be such a run on our hospitals and nurses and doctors and professionals that more people would die, because the more extreme cases could not get the medical attention they need. But here's what I'm saying. Because of the panic created over the news stations, people are stealing Purell from hospitals and doctors' offices. They're stealing masks from hospitals and doctors' offices. They're so afraid of all of this getting to them that they're taking resources that professionals need to actually do the real work.
So let me comment on that. So you may have seen these images floating on social media, including I posted one myself, about flattening the curve. And the curve is right now, there's all these people getting sick, going to urgent care, primary care providers, emergency rooms. And so our health systems are not equipped for that. Right? If all of a sudden hundreds and thousands of people start going to urgent care or the ER because, I feel like I have the sniffles, or I have a cold that won't go away, or I have a fever or whatever, we can't handle that. Emergency rooms are already at full capacity. And so by implementing these community-wide non-pharmaceutical interventions, like these concepts of social distancing, keeping yourself at least 6 feet away from people in public, like the things that we've all been bombarded with, like covering your mouth when you cough, washing your hands many, many, many times a day, wiping commonly touched surfaces down. If you didn't get the flu shot, it's not a bad idea. It's still not too late to get it. All those things, including perhaps staying at home from large gatherings right now, will flatten the curve. That way, you decrease their chances of being exposed because the virus does live on a lot of surfaces and is airborne. And the people who really need to be tested can go get that test, not the worried well who just like, oh, there's a test now. You know what? I want to get it because it exists. I can go right now and probably get it.
Really?
Maybe. I don't know. I haven't tried, but I could be exposed an hour later. So, this is not like a one-time test and you're good. In fact, from the global research so far, it takes about 5 days once someone's exposed for them to exhibit symptoms. And for some people, that 5 days gets pushed back as far as 12 days, which is why they're suggesting if you've potentially been exposed, meaning you've been around someone who is now confirmed with a diagnosis, you've recently traveled back from a country like China, Italy, Iran, South Korea, etc., that you self-quarantine for 14 days. That way, by 14 days, if you don't have any symptoms, you're not going to get this. And that's why people are being asked to do that. It's a safety precaution. And remember, the other thing I want to just mention quickly is 99% of people will recover from this, and 80% of people who actually have a diagnosis of it will have mild to very little to no symptoms, and by managing within their household, they'll never need to step foot in the hospital outside of getting that test.
That point you said just there is what I wish that people would start off the conversation with on every news station everywhere. Just so that people wouldn't be crazy and start doing extreme shit like we just discussed. You know what I'm saying? But what do you think it's smart that we shut off travel to Europe? Like, should we have cut off Europe?
So, that was controversial for many reasons.
Very, very many reasons.
Including because, mainland Europe was cut off, but not the UK and Ireland, which is where the president has properties. And there's, we can talk about politics later if you want, and now that's actually changed as of Monday. It's all of Europe, including, the UK and Ireland and, the United Kingdom. Do I think it's a good idea? I think temporarily, with the caveat that American citizens can travel back. Obviously, we're not keeping our own people outside the country, which is part of the proposal, is not a bad idea. And the reason I say that is because the reasons why these pandemics are global health issues are because, before all this happened, I could get on a plane right now and within 48 hours be around the world. And if I were sick, particularly with something equally, if not more contagious, like with measles, for example, I could infect a lot of people with measles. And we know people have their own opinions about vaccines and whether they're appropriate and exemptions, all that kind of stuff. But global travel makes disease transmission a nightmare to control. And the larger reason this was, there are some definitions for pandemics, but the larger reason why this was declared a pandemic, so it was first declared a public health emergency at the end of January by the World Health Organization. A day later, the U.S. government, Department of Health and Human Services, declared it a U.S. public health emergency. And now just this week, it was declared a pandemic, which means it's something that's new, it's above normal levels, and it's spread to multiple continents. And right now, the novel coronavirus has appeared in all continents with the exception of Antarctica. But the pandemic and public health emergency status allow governments to reallocate resources to help state and local authorities deal with this. So, for example, like you might have seen that the U.S. federal government is offering or instituting $50 billion to small businesses to help re-jump the economy, so that way small businesses don't suffer as much as they already have because of this. So, national emergencies and pandemics and all these words that are being thrown out are more useful to allow the governments to reallocate human and financial resources to deal with the issue. It doesn't mean the world's going to end. It doesn't mean that, everyone needs to be locked up in their house and not leave for the next 2 months. It doesn't mean that. It just means we need to be smart about our own actions, because our actions or lack thereof could impact people around us. The case of the young person who flew from New York City, I think Palm Beach on JetBlue.
Yeah.
He felt fine. He had a pending coronavirus test, didn't disclose that, got on the plane, in fact, was living with coronavirus, didn't get his result till he landed.
He was aware that there was a risk.
He was aware of risk. He felt fine. So he felt fine. So potentially in his travels to the airport, at the airport, on the plane, departing the plane, he has now exposed other people to it. So even when we feel fine, we may still be exposed to it. We may have it, and we may be putting other people who will not deal with it as best as we can as healthy individuals in a bad way. Like those older people, the people with underlying conditions. Unfortunately, we had a death in New York City yesterday, and she was an 82-year-old woman with emphysema who's been already hospitalized with emphysema, a very serious respiratory illness. So she both is in the older group and underlying disease group, who's been, already received a lot of medical care for that issue. So it's not surprising to me that unfortunately she passed away. And that's just going to happen with this. So, we need to just stay calm, unplug ourselves a little bit from all this, and just follow these very basic precautions. And we'll, I think, be okay. But we have to be prepared to be inconvenienced for March and April.
And so it's an intelligent inconvenience, in other words, because I thought it was completely ridiculous. I was like, why are we closing schools? Like, these school-age children all have parents. I was listening to the Joe Rogan Experience the other day, and this viral expert was on, and he was like, 38% of all nurses have school-age children. If we don't have anybody to take, if the children are out of schools, then how do the nurses get to work? We need the nurses in work. Every nurse that I know is working 7 days a week now. You know what I'm saying? So it's like, and school-age children aren't even, they may be carriers, but they're not even really going to be affected by this virus. They have shown resistance to it, correct?
So children who generally have still developing immune systems, so we wouldn't have guessed this, have shown, I don't want to say to be resilient toward it, but to be less impacted by it. And so that's a good thing, because, we don't want to see our...
But is closing schools, why is closing schools smart then?
Well, closing schools allows a few things. One, it allows for schools to start and to continue with thorough cleaning practices. As we can all imagine, there are a lot of germs in schools. Not all germs are bad.
Absolutely.
We need germs to maintain our health as well. But we also know that there's a lot of people going in and out of schools, teachers, parents, staff, other people besides the kids. And so, would you want to send your child to a school where someone was diagnosed with coronavirus? Maybe you don't care, maybe you do, maybe you would pull your kid out anyway. And I think what is happening now, so New York City schools are still open, and there's like all this debate, why are the libraries and schools open, and just for the reasons you mentioned. Mm-hmm. Attendance this time of year hovers around 89% in New York City public schools. Right now, it's about 2/3, about 66, 67%. So parents are choosing to pull their kids out of school for good, right, and different reasons. It doesn't really matter the reason why. So if that attendance number, the number of students present keeps on dropping, then okay, why are we providing instruction when there's only a few kids in the class? Now, like I said, this is a very you're damned if you do, you're damned if you don't kind of situation. And we're not used to it. Usually when we hear about global health emergencies and pandemics, this is like we're talking about Asia, we're talking about Africa, we're talking about low resource countries. Americans might see it for a few minutes on the news, and we keep on going by we continue on with our day. Now that it's impacting us, we have very strong feelings about it. And, the last time we had pandemic status was with H1N1 in 2009, but the everyday American wasn't really impacted by it. As you mentioned at the start, HIV/AIDS is still a pandemic. There are about 40,000 new cases each year, over 16,500 deaths each year. But it doesn't get this kind of attention. This is just something new. We haven't quite figured out. And we're still learning as the situation evolves. And that makes people confused, very opinionated, and upset. Like I said, whether government's doing something or not, people are upset. So, it's challenging. I did see some questions, I think, about
answer questions.
like how did this all start?
Can you see them, Anthony?
I could see a little bit as they kind of scroll through.
You can scroll through.
Okay, yeah. So I saw a question a few times about like where did this come from? So the human coronavirus the family of viruses have been around since the 60s. This is a novel strain, which is why it's called novel coronavirus or COVID-19. So COVID-19, the CO means corona, the VI means virus, the D means disease, and 19 is the year it came. So novel coronavirus or COVID-19, whatever you want to call it. But these viruses have been around for a long time. And for most humans, you get cold-like symptoms, and you probably never knew you were exposed to it, other versions of this virus. So things like MERS and SARS are also part of this family of viruses. And the coronavirus, or COVID-19, is the name of the disease. The actual virus, the name of the virus, is SARS-CoV-2, because it very much resembles the SARS. And the other thing, before I get back to the question I wanted to answer, is why are coronaviruses called coronaviruses? Well, if you actually look at a picture or Google a picture of coronavirus, the actual virus particle, which you need, specialized microscopes to see, they have these little, to me, they look like little antennas, but for a lot of people, they look like a crown. And in Latin, corona means crown. So that's how you get coronavirus. But these are zoonotic diseases, meaning they're passed from animals. And there are some strains of the coronavirus or coronaviruses that only impact animals.
Right.
And there are others that jump species from animals to humans. So the current hypothesis, although again, I can't say this with certainty, is that this started off with bats and then moved to an animal which I had never heard of before all this, which are the pangolins, Pangolins.
Or stuff like that, like.
They look like an anteater.
Yeah. Okay.
Yeah, and in Wuhan, China, there were live animal markets, and different cultures have different culinary practices, and they eat things that we think is weird or whatever. And so from that animal, it then transmitted into humans, and then once it got into one group of people, especially in a large country like China, and with travel, things spread very rapidly. So this is what we call a zoonotic disease, because it started off with people and with animals and moved to humans. But thankfully, I've heard or been asked by several children about, does this impact pets? And I've also heard some sad stories coming out of some veterinary clinics that people think they should be euthanizing their pets because they don't want to get their pets sick. But our domestic animals won't be impacted this, us to them to us. In China, they did do some studies looking at pet, dogs, and they did find very low levels of virus, but it didn't make the dog sick and didn't make their owner sick. That's what viruses do.
Well, technically, could they spread the disease to a human? Could they be a carrier?
No, not domestic animals.
Okay.
Now, there also are, and I've seen this comment, I think, pop up here too, that there are some, I would say, theories out there that the Chinese government developed this virus in the lab and is using it for population control. Listen, none of us unless you're probably one of a dozen people in the federal government right now know the full picture. What information is coming from China to the U.S., from the U.S. to the public, from the health officials back to the public. So none of us really know that. So I can't really comment on that. I'm just sorry, I'm distracted by the high cocoa comment. That's my dog's name. Did I say that?
She's just saying hi to a friend, that's all.
Oh, her friend. That's also my dog's name. Anyway, I can't comment on that. I don't think that's the case, but you know what? I have no way of knowing that.
Okay. This is where I psychologically I get a little bit concerned because last year, let's say I sent you this list of facts, right? I said no children have died of the coronavirus in the States, but people are shutting down schools. Yet between 2019 and 2020, which is very current, 125 pediatric deaths occurred because of the flu, and 5,084 school-age children were killed because of violence. Because of violence. And yet we don't do anything about gun laws. You know what I'm saying? Or you know, so for me, it's almost like Americans are picking and choosing what they get terrorized about, what they feel afraid about. Because the truth is, by at least the numbers that are in now, according to the CDC, your kid has more of a chance of getting death by bullet in the head when they go to school than they do death by coronavirus.
Mm-hmm. So, I mean, you're right.
They're shutting down the schools because nobody wants to be the one that something has spread through. But I don't, and you know, maybe this is even going to be a blessing in disguise because A, our kids are going to finally get to play outside for a while. You know what I'm saying, right? And we'll get to spend some family time together. And maybe the blessing in disguise is going to be employers are now going to be forced to respect people and their vacation and sick time when they say, I need to stay home because I'm ill. Because it's better to have one employee out with the flu or the coronavirus or whatever than it is to force them to come in or encourage them to come in, even when they're not well, and spread it to everybody else, which, you know, especially in the American culture, that is very common. It is almost looked down upon to say I'm sick and I'll stay home. It's very much, oh, why are you lazy? Why aren't you working hard? I came to work with 104 fever. Well, why did you come to work with 104 fever to begin with? That's stupid and it's self-centered. But simultaneously, some people go to work because they're hourly employees and they're going to lose a big chunk of their pay. Like you can't pay rent if you miss a week's worth of work, right? And that's a big concern. So it will bring some light and shed some light onto, hey, we need to address this in terms of our workforce, especially our non-salaried workforce, who should be able to stay home. Like, at least it could show how important it is to stay home when you are sick.
So, I mean, you said several things there that I can comment on. One is, you're right, there are a lot of other pressing public health issues happening, including things like violence, other communicable diseases that most people don't generally care about unless it impacts them directly.
And we don't hear about it.
Huh?
And we don't hear about it.
Yeah, we don't hear about things like gun violence in particular. So that's certainly true. And, you know, maybe one silver lining out of all this is that people will have a better and deeper appreciation for public health. You know, right now about 2.5 to 3 cents for every dollar spent on healthcare is allocated towards public health. If you don't fund these kinds of initiatives, you can't prepare for them and you can't act on them. And we all benefit from them. They're just happening in the background and we generally don't pay attention to them again, unless, again, they impact us. With the schools, you know, K-12 schools do have I think I mentioned this, a lot more flexibility with, a school right now could close for 3 or 4 weeks and then maybe get rid of their April break, get rid of the Memorial Day breaks, extend the school year by a week. And you probably would only really lose maybe a week or two, which in the grand scheme of things is not a big deal. Okay. And so there's a lot of flexibility there. So I don't think people should be too concerned. I say this not as a parent, if the K-12 schools are really going to shut down for 3 or 4 weeks, that most of that could be made up. And I think some schools, and I've heard, in fact, the Norwalk Public Schools where you live have done a really good job about moving things to an online platform in a very short amount of time. So some schools with the right personnel in charge, I think, could respond to this pretty quickly. But I do think we have to, there are some good things that could come out of this, right? Like, maybe there are opportunities to re-engage with kids, to re-engage with your community, to get some fresh air. Thankfully, even though it's winter, we've had some pretty good weather. People don't really have to be cooped up in their own homes. So no one's suggesting you stay home, lock the door, and not leave. It's kind of like keep calm, do what you can, and most, the scientists that I respect say that probably 40 to 50% of the American public will be exposed, if not contract coronavirus. So that's not the end of the world. We all get colds. A lot of people get flu, even when they get the flu shot. It's not, it doesn't protect against all strains of the flu. These are just things our bodies respond to. And so we just have to keep calm about it. I think that's the best thing we can do.
So going out to a public park, how is that different than going to, say, a Broadway play? Because they've closed down Broadway now, right? So if it seems a bunch of people and dogs running around on the beach, are we less likely to contract or pass the coronavirus? Because let's not vilify anybody who has it, because some people don't even know they have it yet. And if not everybody is being tested, especially people who are asymptomatic, right? I mean, I probably don't have it, but I could, being that I'm a relatively healthy 40-year-old woman, I don't have any underlying issues, I could be a carrier and not know it. This isn't like China, right? They're not stopping us on the street. They're not scanning our heads. They're not testing everybody. So in other words, what is the point of shutting down Broadway versus they're not shutting down Central Park, right? Is it less likely to be passed outside?
Well, I think when you're outdoors, you generally have more leeway in terms of doing the social distancing, right? I went for a jog earlier today. I passed a few people on my route. I was, I wasn't up close. I wasn't touching things. I wasn't up close to people. When you're in a place like a Broadway theater, even if you don't touch anything, right? You're in a relatively small area with a lot of people. And so the sick person in the fifth row who gets up to go to the bathroom is maybe sneezes, maybe coughs, is touching things, you touch it, you have a lot more opportunities to be exposed to the virus as opposed to just being outside and maintaining your distance. I say, you know what? Go to the beach, go to the park, go out for a walk, go play with the dog, go do whatever. But if it were me, I probably wouldn't be going to the gym, going to the movies, going into these nonsense of grocery stores right now of the world's not ending, everyone, keep calm. We don't need to be seeing pictures of, no toilet paper and.
There's not. Those are real pictures. Our friends have sent me those are real pictures of this isn't just a meme. Sajni sent me a picture of when she went shopping the other day. They were out of Clorox products. This is really happening.
Yeah, and in fact, I rode the Long Island Railroad yesterday to go do the TV interview, and I felt fine. I was a little more cautious. I didn't stand next to people on the train platform. I didn't touch anything on the train besides the seat I was sitting in. But they're cleaning the trains a lot more now than they ever did. So I actually think the trains and subways are a lot cleaner now than they ever have been. Now the train had a lot, probably was like 80% less people, because a lot of people are working from home or choosing to stay home. But I went on my day. I walked for a half an hour from where I was going from point A to point B in Manhattan. Like I said, I wasn't unnecessarily touching things. I kept my fair distance from people, but I wasn't like walking around with bubble wrap around me. No.
Hi. This is my puppy. She's jumping up. Okay, so this travel, technically, I was going to say travel ban, but that's kind of irresponsible because there's not a travel ban currently. There's not a travel ban, domestic travel ban, correct?
There's not. And, I was supposed to go to Arizona yesterday, and I chose not to. And not because I thought I was going to get sick or, I think there's like a handful of cases in Arizona or whatever. But I'm doing my part, because if I am exposed, or even if I have it, which again, I don't think I do because I don't have any symptoms, then I don't want to be making that older person who's sitting in front of me or that worker in the hotel potentially exposing other people. And that trip can wait. And, I canceled a flight, a car rental, and 3 hotels that were booked through third parties, and basically lost $50 across all of that. So it was pretty easy to cancel, and it'll be there in the fall when I want to go back. So, I think if people don't have to travel domestically, meaning on airplanes, for recreation or work purposes, March and April, don't do it.
Okay, so now I'm going to do devil's advocate here, because I really want to stay. I have a trip planned March 25th to the 29th. Really looking forward to seeing my son in his first aerobatics competition. It has not been canceled yet. So far, it's still going on because he's a pilot. So yes, his academic courses have been transferred online, but clearly his piloting courses cannot be transferred online. That's tactile interaction. He has to see that out through the end of April, May. So we're still looking forward to going down. And what I'm starting to get is backlash. In other words, when fear doesn't work, I feel like we escalate to hate. Right? So it's like if fear isn't keeping you in, then clearly all these people who are still choosing to travel are complete pieces of you know what. They're irresponsible. They're not decent people. They don't want to protect others. And that's not true at all. All I want to do is go see my son in his first aerobatics competition. Do you know what I'm saying? How much threat am I really posing to everybody around me if I go?
So this is what I say. You do you. If you really want to go because you want to see your son, that's an important milestone in his education, there's nothing wrong with that. I was going for recreation purposes, just as like a vacation, right? So like we didn't have to go. There was nothing pressing about it. And we decided not to do it. I don't think we're going to get to the point anytime in the next week or two where domestic flights will be canceled because of this, with the exception of some airlines probably choosing to consolidate flights because people canceling and they're not going to operate a flight with like 2 people.
Because they're canceling like crazy.
And as someone mentioned, I think I just saw scrolling, if you look online right now, like a friend of mine posted, he found a flight, New York City to San Juan, Puerto Rico for $75 round trip. I mean, the sales are ridiculous. But you have to balance, risk and benefit. If you're going and you're staying for 5-6 days, and again, you're practicing your precautions, not only keep you and your son safe, but the people around you, then there's nothing wrong with it. If I were going, I would probably bring disinfectant wipes, I would wipe down the seat and the tray, and other things. You know, the air on airlines on flights, excuse me, have the same air filters that hospitals use. It's very safe air that we're breathing it on flights, but it's usually a matter of people touching things, germs passing, like this guy who went on the flight who had a pending coronavirus test. You know, it's other people's actions that impact you and your health. So it's a balance.
Anthony, excuse me, did they track, did this guy spread it? Did they prove that he actually spread it?
They don't know yet. They do something, when these situations happen, the public health authorities will do something called contact tracing, where they'll basically interview you and ask you for detailed information about what you did and who you've been around. And then the public health officials will say, basically to everyone on that flight, you've potentially been exposed. This is what we suggest you do.
So they'll contact you?
They'll contact you. And probably for those people on that flight, they'll suggest they do a voluntary 14-day quarantine, because just because you've been exposed doesn't mean you're getting it. But if you stay inside in the next 14 days, you don't develop any symptoms, you're okay. But because we know there's a delay from being exposed to developing symptoms.
14 days is that sweet spot.
14 days is the sweet spot.
So let's escalate this a little bit. There was an incident where a man, I think his daughter had come back from Italy, an older daughter, and he had a younger daughter who was having a dance recital. And this was big in the news, where he was supposed to be quarantined because one of his daughters had come back from Italy. And I think she was diagnosed with the coronavirus. I don't think she got ill, but she was a carrier. And he was living in the house with her, but he went out to a dance recital, yada, 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 with his younger daughter. And he felt like, he's like, I'm not sick. I haven't gotten sick. It's been a certain amount of time. I'm not showing any symptoms. I want to go out to see my little girl dance at her dance recital. There was this huge backlash, and even, and this may be untrue, but a threat to forcefully quarantine. Like, instead of just requesting it to stay.
There is mandatory quarantine.
Like taking legal action against it. I thought to myself, that's scary. That's really scary. Would our government be in the right? Would any state or local government be in the right to force somebody who has not been diagnosed with the coronavirus? Just they might have been exposed. Would they have the right to force us to stay home? Like, could this escalate to that level?
So local health departments under public health law do have the right to quarantine people if it's a public health emergency. Okay. That's just, they can do that without going to the police, without going to the authorities. They can do that. And they do that already when people are potentially carrying something like tuberculosis. They can force quarantine. And, you know, that's why some people, you'll hear these terms, some people are quarantining as a form of self-precaution, and some people are under mandatory quarantine. And if you don't do that and you just let everyone decide for themselves, this will never stop. So at a certain point, you do need to do that. Now, we also shouldn't be stigmatizing those people. Like, you know, the lawyer in New Rochelle in Westchester, who basically, that kind of index person has spiraled, like, you know, over 100 people getting sick because they were sick. They got on the Metro North. They went to the city. They went to work. They went here. Their family, their neighbors. A lot of people have gotten sick. We shouldn't be crucifying that man. He didn't know what he was doing. He thought he was okay. And those stories are bound to repeat and happen. So we shouldn't, you know, be blaming or being critical of each other. It's a communicable disease. That's how these viruses work. They're very smart. But the short answer is yes, I do think public health authorities should have the ability to hold people responsible when they have their facts in place that show that individuals or groups of individuals pose a threat to the larger community.
Just straight out, for real idiot answers, people who are Chinese or Asian descent do not have more likelihood of spreading or carrying or passing this virus in any way, shape, or form. The thing is the area. So if anybody, whether you're I hesitate to use the races because scientifically they're not even supposed to exist, right? But even if you're like Western European descent, you have just as much. If you were over in China, you have just as much.
No one is immune from this. I mean, there's a lot of myths, that African American or Black people are getting coronavirus, so they must be immune to it. Or I'm of this descent, so I have immunity to it. No one does. We all can be exposed. We all can get infected. We shouldn't hold people. We shouldn't exhibit xenophobia or racism towards the larger Asian community or people of Chinese descent. This is not their fault. We should not be avoiding Chinese businesses, Chinese restaurants, Chinese friends and neighbors. This is everyone's issue at this point. So we just have to move past that. But, there's a lot of xenophobia and racism right now, and makes this just as much a social disease as it is a biological one.
Well, see, that's what I'm saying about this whole fear factor. And that's why I like to pull up other numbers. Because I like to get into people's head and say, you do realize that other things that may be more pressing are happening right under your nose every single day. And you're not afraid of them or thinking about them at all.
Yeah, this is just getting a lot of attention.
Now those tickers online, the media, and I was so irritated. I was watching an interview the other day. I think it was ABC, and they had a wonderful guest on. I forgot his name, but he was a virologist. Am I saying that right? So he's an expert. He tracks these trends. But the first thing they do is they ask him about all these things. They ask him questions that basically defend their coverage of this virus and everything. In other words, are people really dying? The estimate amount of how many people will die. And, you say things like 1 million people by the end of this pandemic. 1 million people globally are dying, are predicted to die. And in my head, I'm like, there's 7.5 billion people on this planet. If 1 million people are taken out, that's still not a huge threat to us.
Well, I hope it doesn't happen.
I know. People are saying, Michelle, you're so callous. You want 1 million people to die? No, I don't want 1 million people to die. But, let's face it, ultimately, and I'm human, I could get this virus just like you could get this virus. But ultimately, people die all the time. Death is something that's real. You think that people are just realizing this now. And to me, I'm like, what is wrong with you? Are you really kidding me right now?
Yeah. Like I said, we're in a difficult time because this is an evolving situation. We're being bombarded with information. Some of it's correct, some of it's not. There's a lot of misinformation spreading, and we can't unplug from it, even if we try. I tried not watching TV yesterday afternoon because I don't need to hear more about this. And I went for a jog. I took the dog, which you now see here, out for a walk. And I came back from everything, and my phone was blowing up. Oh my God, did you see this? Did you see that? Did you see what the president said? Did you see that? Should I cancel my job? And I was like, we have to just chill about this. And I think that's one of the risks we take, is that we're just overwhelmed by the information. Most people are not public health officials and epidemiologists and virologists and people who, know this, but it seems like on social media, everyone's an expert all of a sudden. We need to do this. We need to do that. We should do this. We shouldn't do that. Let the people who've been preparing for this do their job. And, you might have heard the reports that a couple of years ago, the current administration basically fired the pandemic response team. When you don't invest in pandemic preparedness and response, this is what happens. But people generally don't like investing in things when they don't think it's going to impact their day-to-day. But now you see why it's so important. I probably could take a couple more questions because my phone is on 3%, and I don't want to like disconnect from you.
Take two questions. If you see questions that you want to answer.
Yeah. I saw.
Just quickly say the major points of contention for you in terms of what do you need to tell people right now? It's just not. Oh, we only have 30 more seconds.
So
we only have 30 more seconds.
Keep calm, follow the science, and don't get overwhelmed by the media and social media.
So where can we find the science?
Coronavirus.gov will take you right there.
Thank you, Anthony, so much. You're